Hello students, we'll commence with the next topic in chemotherapy, anthelmintic drugs. So the learning objectives for this session include first to know about helminthiasis and second to study the pharmacology of drugs used in the treatment of helminthiasis, that is anthelmintic drugs. So let's start with helminths. Helminth, what does the word helminth mean? Helminth means worms. Now basically these are what? Parasitic worms. And anthelmintic are drugs which act against these parasitic worms. Now, basically, to be an effective anthelmintic, a drug must be able to penetrate the cuticle of the worm. Cuticle is the covering, the skin of the hard coat of the worm, cuticle of the worm, or should be able to gain access to its alimentary tract so that it can disturb its metabolism. So this is a property for for a drug to be called as an anthelmintic drug. Now, how do these drugs act? So these drugs they act either by causing paralysis of the worm. Now, paralysis of the worm is happening by what all mechanisms? It can be either due to the paralytic action or mimicking the action of a GABA or opening up the chloride channel for hyperpolarization so that there is minimal activity, or it could be like anything like it can be acting as a nicotine stimulator or an anticholinesterase like effect which causes spasms and finally paralysis of the muscle. So these drugs they act by paralyzing the worm and by damaging its cuticle, and once this effect happens, then there is a partial digestion or rejection by the immune mechanism, the host's immune mechanism, and it can also act by altering the metabolism within the worm. So there are multiple mechanisms where the anthelmintic drug act. Basically, the main aim of these drugs is to cause paralysis of the worm, damage its cuticle, and to modulate the immune mechanism of the host, so that the parasite, so that it becomes susceptible to the host's immune. Now, talking about the classification of helminths, helminths are basically classified into three classes. So the classes of helminths are conveniently divided into tapeworms, flukes, or roundworms. Now, tapeworms are called as cystodes. Now, cystodes, common examples are Tinea saginata or Tinea solium. Flukes are also called as trematodes, and the examples are schistosomas, Schistosoma hematobium, Schistosoma mansoni, Schistosoma japonicum, and roundworms or hookworms, they are also called as nematodes. Best example is Ascaris lumbricoides, which is a very common helminth in the residing in the alimentary tract, or Enterobius vermicularis, or tissue roundworms like Dracunculus medinensis or Wuchereria bancrofti or Loa Loa or Onchocerca volvulus. And accordingly, these helminths they produce certain diseases or infections which are basically due to infestations of the parasite, like in case of nematodes it could be elephantiasis or loasis or onchocerciasis, or in case of trematodes it could be schistosomiasis. So drugs are classified basically based on which helminth they act. Most of the drugs they are effective against nematodes. Some of them only are effective against trematodes and cystodes. In case of nematodes, there are a lot many drugs like benzimidazoles or piperazine or diethylcarbamazine citrate or pyrantel. For trematodes, it is the praziquantel drug, and for cystodes, it is niclosamide. Well, coming to the first class of anthelmintic drug, the most commonly used drug, which is called as benzimidazole. The drugs which are coming under this class are mebendazole, thiabendazole, and albendazole. Uh, the benzimidazoles are broad spectrum agents and constitute one of the main groups which are used clinically. The mode of action of all these drugs is that they bind to the free beta tubulin. Now, this beta tubulin is a protein basically. Now, the role of beta tubulin is to undergo polymerization and help in the formation of microtubules, which serve as the skeletal system for the living cells. Now, that is basically to strengthen the skeletal system. Now, once these drugs they bind to beta tubulin, subsequently polymerization is inhibited and interferes with the microtubule formation, and therefore the skeletal system becomes more weak, and they have less immune reactions, and they are easily excreted from the body, because basically these worms they cling to the tissues or the intestinal abdominal walls and all, with their strong cuticles, and it all depends upon how strong the skeletal system of the worms are. So once the skeletal systems are weak, then automatically they get detached from the alimentary tract tissues, and with the strong dose of purgative and all, they are flushed out from the intestinal tract. These drugs, they also have a selective inhibitory action on helminth microtubular function. That's what we have seen. And it is 250 to 400 times more potent in the helminth than in the mammalian tissue. This is a very characteristic feature of this drug. Only 10% of mebendazole is absorbed after oral administration, and a fatty meal increases absorption, and the products are metabolized and are excreted in the urine within 48 hours. So it is given as a single dose for threadworm and twice daily for 3 days for hookworm and roundworm infestations. See, most of the anthelmintic drugs, they have very few side effects, and mostly they are gastrointestinal related. There is no severe or adverse effects, except for very few cases some allergic reactions may be produced. But otherwise, it is very common, like common headache, dizziness, drowsiness, or something very common. So the unwanted effects of these drugs, mebendazole, albendazole, and thiabendazole, are mostly gastrointestinal disturbances, and that also they occur very occasionally. And there is a also transient headache, dizziness, drowsiness is also reported, and in some cases, fever or rashes with allergic reactions may occur. Albendazole, the most recently introduced benzimidazole, which is again a broad spectrum anthelmintic, is given orally and is metabolized to sulfoxide and sulfone, which is responsible for its anthelmintic action. The drug thiabendazole produces least side effects and therefore widely used. The next drug, praziquantel, is again another broad spectrum anthelmintic drug available in UK, and it is a drug of choice of all species of schistomes and is very effective in cysticercosis. So it is very effective in cysticercosis or schistomes. It acts in a very different way. It acts by altering the calcium hemostasis in helminth cells. This causes contraction of the musculature and eventually results in paralysis and death of the worm. So excessive contraction or spastic contraction of the musculature of the worm results in paralysis and death of the worm. It has also been suggested that praziquantel modifies the parasite so that it becomes more susceptible to host's normal immune responses. That means the worm's immune responses decrease, and it appears in such a way that the host's normal immune response is strong enough to eradicate the worm. So we have seen about praziquantel, the drug which is effective against schistosomes, and is very effective against cysticercosis. Now, let's go for the other drugs. So, talking about the next drug, piperazine, Now, piperazine is used to treat infections with common roundworm, that is Ascaris lumbricoides, and the threadworm, Enterobius vermicularis. Now, the mode of action of this drug is it reversibly inhibits the neuromuscular transmission in the worm. This is done by probably by acting like a GABA, the inhibitory neurotransmitter on the GABA gated chloride channels in the nematode muscle. So what happens is the muscles get paralyzed because of the GABA effect, and the paralyzed worms are expelled alive. The next drug is pyrantel. Now, pyrantel is a derivative of tetrahydropyrimidine that is thought to act by depolarizing the Helminth neuromuscular junction, causing spasm and paralysis. So, by continuous depolarization, rapid depolarization of the Helminth neuromuscular junction, it causes spasm and paralysis. It also has some anticholinesterase activity. So, both the mechanism action acts in case of pyrantel. This drug is very poorly absorbed from the gastrointestinal tract, and 50% of the drug is being eliminated in the fecus as such. The next drug, niclosamide, it is basically a drug of choice for the tapeworm infections, which has largely been superseded by praziquantel. The scolex, in this case, the scolex, which is called as the head of the worm with parts that attach to the host intestinal cells, and the proximal segment are irreversibly damaged by the drug. So what happens is the worm separates from the intestinal wall and is expelled. So neither the larvae nor the ova are affected. A purgative is necessary in such a case because the damaged tapeworm segments may release ova which are not affected by the drug. So there is a theoretical possibility that cysticercosis may develop for other tapeworm infections. The next drug, oxyminiquine, it is active against Schistosoma mansoni, affecting both mature and immature forms. Its mechanism of action may involve intercalation in the DNA, and its selective action may be related to the ability of the parasite to concentrate the drug. So the next drug is metryphonet. This is a drug which is only available in UK. It is an organophosphate anticholinesterase that was originally used as an insecticide, and it was found to be subsequently very effective against Schistosoma hematobium. Now, this is used for the treatment of schistosomiasis. Now, schistosomiasis is a condition wherein the parasite, either Schistosoma hematobium or Schistosoma mansoni or japonicum, this is a freshwater parasite and gets contaminated with the freshwater here gets contaminated with animal or human fecus, and the parasite penetrates the human skin to enter the bloodstream. So this is how the infection takes place. This condition is called as schistosomiasis. Now this drug is a prodrug and gives rise to an active drug called dichlorvos in vivo. The next drug, diethylcarbamazine, it's a piperazine derivative that is active in filarial infections caused by Wucheria bancrofti and loa loa. Now, Wucheria bancrofti causes elephantiasis, wherein the lymphatics are concentrated with the filarial adult worms and they dwell there and multiply, and because of which the size of the leg, the lymphatics, they enlarge and all, and the size of the leg of the person takes the shape of the elephant. That's why it is called as elephantiasis. Loeloasis is also an infection which is a localized angioedema in the skin, and here there's a possibility of the worm getting migrated, the adult worm getting migrated into the conjunctiva and affecting the other tissues like the eyes and all. So this drug basically it acts, it has been suggested that it modifies the parasite so that it becomes susceptible to the host's normal immune responses. So it modifies the parasite. The immune response of the parasite is so dulled, it is so decreased that it is becomes more susceptible to the host's normal immune responses. The next drug is levamisole. Levamisole is effective in infections with common roundworms like Ascaris lubricoides. It has nicotinic-like actions, stimulating and subsequently blocking the neuromuscular junctions. And the paralyzed worms are then passed out in the fecus. The ova is not killed. So the drug is given orally and is rapidly absorbed and widely distributed. It also crosses the blood-brain barrier, and other pharmacokinetic and unwanted side effects are more or less common. Ivermectin. Now, this drug is a semi-synthetic agent which is derived from a group of natural substances called as ivermectins, and it has a potent anthelmintic activity against filaria in man, and it is a drug of choice for onchocerciasis. Onchocerciasis. This drug causes this disease, onchocerciasis, causes river blindness. This drug is also very effective in Wucheria bankrupti, which causes elephantiasis. A single dose kills the immature microfilaria of Onchocerca volvulus, but not the adult worms. So this drug, ivermectin, reduces the incidence of blindness by up to 80%. It is also thought that the paralysis of the worm is also being done by this drug by opening up the chloride channels and increasing the chloride conductance. So we have seen with a lot many classes of drugs, starting with the most commonly widely used benzimidazoles, praziquantel, then piperazine, pyrantel, niclosamide, oxaliplatin, metryptonate, diethylcarbamazine, levamisole, ivermectin, all acting in such a way that it will paralyze the worm, either through increasing the chloride conductance or having anticholinesterase like activity or like increasing the nicotinic effects or GABA like action or modulating the host of the worms such that it becomes susceptible to the patient's immune responses. So the various mechanisms are dealt with in anthelmintic, and this is a very small topic but a very interesting topic. The untoward effects of all these drugs are very minimal, and the kinetics is also simple. Okay, that's how we end with this topic. Okay, thank you so much. I hope all of you have understood it.